Good evening, everybody. It's great to be speaking to a crowd in Guernsey. I think all of us Canadians would love to be there tonight with you. It'd be a great day for us to be there because maybe you know, or maybe you don't, but it's our national holiday today. So Greg and Kieran and I'm sure will be tipping a glass later today. I just wanted to speak to you very quickly about Canada and the UK and the parallels between these two markets, because we've experienced a lot of this in the past. And I just wanted to give you a little bit of history here about the Canadian market and how it relates to the UK. And now I'm just trying to find how to advance my slide here. Just one second. Sorry about this.
Talk if you don't pull the screen up.
I know I got it. Okay. Canada, we have a population of approximately 37 million people. And we've had a cannabis regulatory framework for some time now. It all started in 1999 with legalization for access to dried marijuana for medical purposes. But at the time, there was no regulation. So it was, in a sense, a lot of what's gone on in the UK, in that the government said, okay, it's legal now, but we're not really going to tell you how to access good, safe product for its use. This changed a little bit in 2001 with the Medical Marijuana Access Regulations, MMAR. It created a framework for people to access, which was either through growing it themselves or giving a license to grow to somebody else. But that really was very much an imperfect system, and really led to the development of quite a robust illicit market here in Canada. And so the government recognized that in 2013, we got the Marijuana for Medical Purposes regulations, which was the first time that there was really an industry behind a regulated medical cannabis market. So this was a monitored and regulated, industry that the government watched very, very, very carefully. But it gave the opportunity for patients to have access to cannabis, not only to see doctors more freely and to get prescriptions, but to have access to a wide variety of different cannabis strains, which included CBD varieties, both pure sort of high CBD and balanced varieties, because prior to that, it was almost exclusively high THC strains. So the industry and the market grew very, very quickly under the MMPR, where we went essentially from no patients to over 350,000 patients in less than 5 years. That peaked out in September of 2020, 377 active medical patient registrations. That means 377,000 people who had a medical document from their physician at that particular time. So there certainly over the 5 years were many people that got medical documents from doctors, but didn't, for one reason or another, renew. So that number of people who actually had a document at one point over that 5-year period was certainly a much bigger number. Presently, we're March 2021 is the most recent data point that we have. This number is now down to 292,000 people, because we now have a full adult use legalized market as of October 2018. And this is interesting because it's created quite a large industry here in Canada. The adult use market is probably 5 times the value of the medical market now. It's interesting to see that the medical market really has not suffered greatly, when we brought on the adult use. So there's clearly a very well-defined need for medical cannabis. So next slide. This is just a pictorial of what I just talked about. It shows you how it grew, started in early of 2014, inflection point in early 2016. Adult use came on in late 2018. In 2019, we had kind of a second stage of adult use with legalization of the sale of cannabis extract products. So that is concentrated vaporizer products as well as edibles. And really the adult use market, of course, has taken off over that time. You can see the subsequent small pullback in the medical market, but really small when you look at the grand scheme of things. There was a very interesting survey that was conducted by the Canadian government in 2020. And this is freely available online. So if you're interested in the habits, opinions, and behaviors of people who use cannabis, it's quite an interesting survey. But it was the results of the survey based on close to 11,000 people. And of those 11,000 people, 27% of the people reported that they used cannabis at some point in the last 12 months. So this is really quite a high number, probably a little high because people knew that it was a survey on cannabis. So if they were cannabis users, they were probably more likely to participate. But other surveys have pegged that number at somewhere, around 15%. So maybe the real number in terms of who is a cannabis user is probably somewhere in the middle. This survey as well estimated that 14% of Canadians aged 16 and older claim to use cannabis for medical purposes. And so this is a little bit more than half of the respondents to the survey. We do know that people who use cannabis recreationally, for many of them, there's an underlying medical need that they are treating, whether they're conscious of it or not. It's there. Maybe it's pain, maybe it's anxiety, maybe it's just to relax, but there's definitely a medical need or a wellness need that drives this adult use. It's interesting though, of this, fairly high percentage of 14% saying they used for medical purposes, only 1/4 of them actually did this with a document from their healthcare professional. And the vast majority of them, 3/4, did so without a document from their healthcare professional. So what this is really saying is that there are people who seek this and go to see their doctor about it. And then there's a whole other group out there that don't. But if there's only a medical system, many of these people will find their way into the system because it creates a legal framework for them to access and use cannabis medicinally. So when we take a look at the UK, I'll just touch on this very, very quickly because Mike really spoke about much of this. But legalization happened in November 2018 as a result of Hannah's work. But there was really no supporting regulatory framework. And as a result, the patient growth in the system was negligible. This improved a little bit in January of 2020 because they allowed private medical clinics to operate. And we now understand from Mike the importance of these clinics. Currently about 6,000 patients in the UK. This is about 16% month-over-month growth, which is terrific. It's strong growth, but it's really a long way from where this market truly should be. There has been very interesting debate in the House of Commons as early or as recently as June June 14th, I think, of this year, looking at changing and advocating for the change of the outdated 1971 Misuse of Drugs Act. If this changes, this will likely allow GPs to prescribe, which will result in really exponential growth on these changes. And Mike also touched on the Project 2021 initiative, which is really a terrific initiative, which is looking to follow, and I hope I have the number correct, Mike, but 20,000 patients who are using medical cannabis, which will create a very impressive database, and potentially probably one of the largest real world databases that, that we have for medical cannabis. Other studies like this have been done. There was one done in Canada, a registry database of about 1,500 people in the province of Quebec. And it showed, I mean, there are preliminary results already from Project 2021. The results were very similar. Well-being improved, of course. It was completely safe. But they also saw, secondary benefits, which were very important, such as the ability for people to taper off their use of opiate medications or completely eliminate, opiates when replacing with cannabis, which is a much more safe option for these patients. So that's very, very good things that we're learning from real world data. So, quickly, the UK opportunity, if we compare it to Canada, 66 million people. Mike gave you the numbers, and I promise I didn't share notes with Mike before this presentation, but estimated 1.4 million people who are using cannabis right now medicinally in the UK. The market is expected to be 340,000 patients by 2024, sales over $1 billion potentially. And then 1% of the population by 2028. And if we take a look at Canada, these numbers are very, reasonable. We've basically seen this story before, obviously from the Canadian experience. So what we know in terms of keys to success, and as others have alluded to, controlling the supply chain, of course, is extremely important and ensures consistent availability of product. And that's what, our facility in Guernsey is going to allow us to do. Ed touched on the importance of, and Mike did as well, expanding medical cannabis access for patients, Hannah, of course, as well. Growing the prescriber base, having GPs, giving GPs the ability to prescribe is certainly very important. But we know from the Canadian experience that there was lots of GPs that decided to prescribe, but in the grand scheme of things, it was really a small number compared, to the number of prescriptions that were written. Most of the prescriptions were written through medical cannabis clinics, probably 80%, because most GPs are just not comfortable writing those prescriptions. They just don't really understand enough about the treatment, so they prefer to refer. But I would say the vast majority of doctors are supportive of their patients having medical cannabis, but would prefer referring rather than writing a prescription themselves. And then, developing a branding and prescribing framework to simplify medical cannabis experience for patients and healthcare professionals is extremely important. This is what we did at Mettrum with developing the Spectrum brand. And that was one of the reasons why we were acquired by Canopy Growth, is they were interested in the way we constructed this brand to make it easy for patients and doctors to understand. And then we also had a clinic network structure that they were interested in. And that's the reason why we were acquired. And also one of the reasons why Canopy has been successful in the market in Canada. So that's really all I have to say. We've seen this movie before, and I'm looking forward to watching it play again.